Good evening, folks. This is Dr. Paul. Thank you very much for tuning to my channel today. And many people are asking me about herpes, and I would like to talk about it. Remember, I only see patients in my clinic. Okay, some patients are calling and saying, please mail in a prescription. I don't do that. Okay, you need to come and see me in my clinic. So let us see about herpes today. A lot of people are getting herpes infections in their mouth and gums and pharynx and genitalia. It's everywhere. So it's important that you understand about this. Even sun exposure can provoke an attack. Now, 25% of US population have herpes simplex type 2. There is herpes simplex type 1 and type 2. Both can cause herpes. Okay. Usually, type 1 affects mouth and type 2 affects genitalia, but that's not always the case. The infection is acquired by sexual contact. Even in monogamous heterosexual couples, if one partner gets herpes infection, the second one, the non-infected partner, can get it in the next 1 year. And up to 75% of those infections are transmitted during periods of asymptomatic shedding. So don't think if somebody is not symptomatic, don't think they are not transmitting it. They may not have any symptoms and they could still be transmitting it to you. And sometimes they say, I'm burning, and then you know their lips are burning. And they have vesicles, basically pearl-shaped clusters. Whenever you see pearl-shaped clusters, that is herpes, until proven otherwise. And if they say they have it on the lips and or penis or in the vaginal area or perianal area and the buttocks, wherever it is, just to stay away from those lesions, because you can easily get those herpes virus into your body. And some people have swollen lymph nodes, and these lesions, they crust and heal in 1 week. Immunosuppressor patients have a higher risk. They may even have repeated severe attacks of herpes. Lesions of herpes simplex, you should always distinguish them from similar looking lesions like syphilis, chancroid, pyoderma, and trauma. Test it. Direct fluorescence antibody can give you rapid diagnosis, viral culture, polymerase chain reaction. You can ask for a test, but usually herpes serology is not used in the diagnosis of an acute infection. Most of the time, I don't even worry about diagnosis. When I see these lesions and there is a history and there is a reasonable suspicion of herpes, I will just go ahead and treat it, because testing is costly and also it takes a lot of time. Complications also you need to remember. You see, herpes sometimes can go into your brain, causing encephalitis. It's called herpetic encephalitis. In wrestlers, they can get herpes by contact. Sometimes it can affect the eyes. So you need to take this seriously. And there are 3 medications I use: acyclovir, valacyclovir, famciclovir. I usually go with acyclovir, but all 3 agents are effective, and use them properly. They do not cause serious side effects. Now, only acyclovir is available for intravenous administration. In the immunocompetent, with the exception of severe orolabial herpes, only genital disease is treated. If you have recurrent episodes, if it is a mild recurrent episodes, I don't even use any medication, but can use acyclovir 400 mg 5 times daily. If it is the first time, valacyclovir 1000 mg orally twice daily, famciclovir 250 milligrams 3 times a day. And usually I treat for 7 to 10 days. Based on the severity. If it is too severe, I treat it for 10 days. Now, what about the recurrences? If it is a mild recurrence, I don't even treat it. And pharmacotherapy is also actually not much beneficial in those cases. And many studies are showing that. To be effective, the treatment must be initiated by the patient at the first sign of recurrence. So if the treatment is desired, then recurrent genital herpes outbreaks may be treated with 3 days of valacyclovir, 500 mg orally twice daily, or 5 days of acyclovir, 200 mg orally 5 times a day, or 5 days of famciclovir, 125 mg orally twice daily. Valacyclovir 2 grams twice daily for 1 day, or famciclovir 1 gram once or twice in 1 day, are equally effective short course alternatives and can abort impending recurrences of both orolabial and genital herpes. So, if there is a lot of pain and tingling, then you can also use a little bit of corticosteroid cream. Many people get relief from pain with a little bit of steroid cream like hydrocortisone or triamcinolone. And if they have severe recurrences, suppressive treatment is recommended because they will reduce outbreaks by 85%, viral shedding by 90%, and that results in about 50% reduced risk of transmission. So, if you are having repeated attacks, just take acyclovir 400 mg twice daily, and or valacyclovir 500 mg orally once daily, or famciclovir 250 mg orally twice daily, pritelivir 100 mg orally twice daily. They have superior reduction. Please give me 5 minutes, baby. Are you urgent?
Yeah, I'm hurting really bad, but I'm gonna go get ready to go to the hospital.
I'm coming, baby.
Okay.
So these are the important points. You can also use your latex condoms to prevent, and it's effective in reducing genital herpetic transmission, and no single or combination intervention absolutely prevents transmission. And if you are going to beach, always use sunscreens because sun can provoke herpes. So use ample amount of sunscreens. A preventive antiviral medication should be started beginning 24 hours prior to ultraviolet light exposure, dental surgery, or orolabial cosmetic surgeries. You can also use local measures, topical therapies. Even though they are limited efficacy, as I said, hydrocortisone or triamcinolone creams, they give a lot of relief when patients are having severe pain. Now, what about COVID pandemic? A lot of people are having issues with herpes. If you have herpes lesions on your face or any part of your body, cover them, because COVID virus can easily go into your body if you have open lesions. If you are on your face, always wear a face mask. And if you're going to beach, use sunscreen to protect yourself, because sun can aggravate herpes in your body, and herpetic lesions will put you at increased risk for COVID transmission. So these things will prevent you. And if you are putting away your face mask, always keep it in a safe place, because if you have herpes on your face and somebody touches the face mask you just used, they will get herpes or even COVID. So if you touch that face mask, throw it away in a secure place or keep it in a bag, or if you want to reuse your face mask, just keep it in your lap. So those are the things I wanted to share with you. Like, remember, if you want to get treatment, please visit me in my clinic, Dr. Paul's Clinic, 1516 Martin Street, State College, Pennsylvania. Thank you so much. Have a nice day.